Okay, guys, welcome everybody. My name is Gary Colvin. I'm the Senior Vice President for Channel Services for Evolve IP. And welcome to this month's channel training on healthcare and compliance in the cloud. This is a widely discussed and debated topic. It seems that these days everybody claims to be HIPAA compliant, and we want to try to clear up some confusion as to what does it mean to be HIPAA compliant and how can we help and what resources we can deliver. And so I'm really looking forward to this. We've got some really great speakers here. Just a couple of quick housekeeping items. So we're going to wait for the slide to advance here. There we go. So we got a couple new additions on the channel team that I want to make you guys aware of. About a month ago, we had Rob Zambrana join us as the Southwest Channel Advisor. Rob is based out of Dallas. And just this week, we had Scott Alter out of Chicago join us as the Central Region Channel Advisor. So we're thrilled to have those guys on board. And just a couple of quick things here. I want to make sure that you guys are aware of the upcoming trainings for December because they're really important. Friday a week, December 8th, is going to be the last monthly deep dive for 2017. There's some new, we're always updating the content. That's the session that I run, so we're looking forward to that. But the one for sure that I want to make sure everybody registers for is the December 14th rollout for the Evolve Contact Suite. That is our in-contact killer, so to speak. That is just going to be a real exciting launch and opportunity for all of us in 2018 and beyond. So let's go ahead and get started. Let me introduce our speakers. First, I want to introduce you guys to Tim Vogel, who is our Vice President of Compliance and Security. That's a nice-looking picture, Tim. I like that.
Thank you.
And a longtime friend and associate of mine, Bob Healy, whom I think, Bob, we've known each other for 10 years now. So these guys are in charge of the platform when it comes to healthcare and compliance, and they've got a lot of terrific information. So I'm going to turn it over to Bob.
Great. Thank you, Gary. I appreciate it, and thank you, everyone, for joining us today. We are going to cover compliance, but specifically HITRUST, and try and debunk some myths, and then try and help everyone on the phone focus on what are good targets so we can, hopefully earn some business together. So the agenda today, what we're going to cover is, HIPAA versus HITRUST. We're going to talk about what it means. We're going to talk about covered entities and business associates, other buzzwords that you hear. Talk about the misconceptions. We're going to discuss what to look for, and then questions that we can ask in the field. Also, what we're not going to cover today is, all the current cyber, physical, personnel threats that are out there. We're not going to talk about security and preventative measures or breaches and the impacts, fines, or even specific requirements of the compliance or the technology. They are all critically important topics, just not for today. What we want to focus on today is what's on the left-hand side there is high-level education, and then we'll cover those specifics as we progress together. Okay, so just real quick on Evolve IP, probably everyone on the conference has seen this slide from us in one format or another, but these are our 6 key differentiators in the market. And today we're going to focus on the middle two, which is our best-of-breed solutions that are on world-class compliant architecture. And part of why we have industry-leading satisfaction with our clients is because we do provide these solutions in an environment that's better than they can get it other places. Okay? And also, when we talk about our strategy, cloud as a strategy, this is part of our strategy. How do you leverage the cloud in a compliant environment? Okay, so under best-of-breed solutions, right, what you see here are all of the blue-chip technology, all name-recognizable technologies that we have deployed in our platform. And on the right-hand side there, you see the third-party audits that we've gone through. The most important is the HITRUST. Right, we're going to talk more about HITRUST, what it means, and why HITRUST is better than some of the other individual compliances. But the HITRUST certification covers the entire platform. Okay? And as a testament to that, that's why almost 40% of our new sales do come from one of our 3 key verticals, with healthcare being one of them. And what you can see on here is just some of the more name recognizable logos that we have as clients. Okay, so how did HITRUST start? Let's talk about that for a minute. I'm going to ask Tim Vogel to touch upon that.
Oh, thanks, Bob. So the issue that occurred after HIPAA was brought into force by the U.S. government to protect healthcare data was that it wasn't prescriptive, and there was no way to validate that somebody was HIPAA compliant or not. And so you could have different auditors who had different opinions on the same organization, on whether the compliance was adequate. So what this caused was lots of organizations to do third-party risk assessments on their business associates that they would do business with to ensure that they were not providing an additional risk profile to the either the healthcare provider or the insurance provider. This was cumbersome from both the provider themselves and also the BAs. And so what ended up happening is initially a lot of the insurance providers, the payors, came together and decided, hey, we need a way to have something that would be a standard way of evaluating a third party for compliance to HIPAA standards. Initially it was HIPAA, but it could be applied to almost any security standard. And so this is how HITRUST then became formed, which is a comprehensive framework to validate security protocols around healthcare and non-healthcare moving forward.
Can I ask you a quick question?
Sure.
And I'm just trying to clear something in my mind, and I'm sure the partners would think the same thing as well. I had understood that a HIPAA rule might be, hey, you have to have a firewall. Whereas HITRUST actually defines what that firewall needs to do. Is that a safe assessment?
Correct. So while HIPAA is a more generalized guidance of certain pieces around security that need to be in place, it's not prescriptive. So for example, a secure password for one company, they may decide, a 4 or 5 character password is what they deem secure. All HIPAA would say is you have to have a secure password. Where on the HITRUST side, it would be more prescriptive to say, hey, a password must be 8 characters long, contain upper, lower, numeric, and symbols, and be changed every 90 days.
Got it. Thank you.
Mm-hmm. And we have a little bit of that as an example in a few slides. So why would a business, follow HITRUST, right? One would be to be secure, right? Adopting a culture of compliance throughout the entire organization, right? Another reason might be they need to definitively demonstrate that they have a commitment to the highest standards of security and compliance, whether it be internally, up to executive management or a board, or externally, right? And another reason, which is very legitimate, is they're required to do so, either legally to keep a customer or possibly to gain a customer. I will tell you, again, part of our strategy, and those of you on the phone who have worked with us will know this, that there are plenty of things that we've done to win a customer's business that we did for the first time. But that's how you build a business, right? So the priority here depends on that individual end user and that individual customer. But many people become HITRUST certified simply because their largest customer told them they had to. Okay? So the industry adoption, right? So I'm going to ask Tim to talk a little bit more about this, again, how it started and the reason why these organizations banded together.
All right, so as I mentioned, the HITRUST framework itself was kind of an industry-focused framework to give a standard methodology of providing compliance for security across healthcare field initially. And so once that was in place and started having adoption by payers and health plans, eventually what ended up happening, and this was about 20 months ago now, 5 of the largest healthcare payers in the industry came out and basically issued an edict to all of their business associates and basically said, listen, we have this standard now that can be audited independently by a third party in a uniform way. So instead of us focusing on doing individual audits for compliance for all of our business associates, which was over 7,500 at the time between the 5 of them, that they were going to request or dictate, really, that their PAs go through and become HITRUST compliant. So business associate, so a business partner of the health plan or the payer. And so what this entailed was giving them about 24 months, so we're almost to the end of the 24 months from when this letter was written, and to go through becoming HITRUST certified, have everything in place, and have a approved HITRUST assessor or auditor, you could call it, go through and do it within 2 years. So we're kind of at the trailing edge of that, but that's what initially really pushed off the industry adoption of the HITRUST framework.
Tim, real quick question here. I just want to get a little clarification on business associate.
Okay.
Does that mean that if it's an insurance company and I'm one of the insurance agents, am I a business associate?
Yeah, I think we get to this, but just very, very briefly, a business associate is anybody who transacts business with a covered provider. So covered provider is anyone who gathers or processes healthcare data. So that would be any kind of healthcare provider or an insurer who pays healthcare claims. All of their subcontractors that they do business with. So hosting providers, telecom providers, but even as far as people who do printing or anything like that become business associates.
For the record, guys, Bob just kicked me under the table because apparently he's already got this.
Jumping ahead.
I jumped ahead, so sorry.
This is Bob. So to follow back up on what Tim was saying about an assessment, it's about an assessment versus a legitimately third-party audit and a difference between HIPAA compliant and HITRUST certified. Right? One is an assessment, and assessments can vary based upon individuals' opinions. The other one is a certification against defined standards. So Tim, can you just speak a little bit more specifically about that as we outlined here?
Right. So the HIPAA ruling is open for interpretation. So it's loosely defined requirements such as you have to have strong passwords, you have to have a firewall. This is what you should do. And then you can have it evaluated by someone who's doing an assessment, but they have an opinion on whether or not you are living up to the requirements or not. But it is, again, an objective look at it where it's, you could have 2 different auditors differ in opinion whether you are actually meeting a certain requirement. Where HITRUST and a HITRUST certification is prescriptive, so it defines exactly what you need to do based on your security profile, based on the size of the organization, which it can vary at that point, but it's prescriptive. So we've mentioned the secure password example, or you have to have firewalls that are only allow in required traffic, what they should block, least possible external profile. It's very, very prescriptive in that way, and gives a lot more guidance. So when 2 different auditors would audit or assess someone who's going for HITRUST, they should come always to the same conclusion, as opposed to it being potentially differing opinions.
Yep. Good, thank you. So again, assessment versus a third-party audit, right? So also HIPAA is a 20-plus-year-old government regulation that has been infrequently updated over the years, and it's also typically applicable after the fact. So, what often will happen is, there will be a breach or there will be some incident will happen, and then people come in and determine if you were compliant or if you had the appropriate standards in place, as opposed to HITRUST, where it's industry-driven, not government-based, and is a risk-based adaptive framework that upfront certifies that you are maintaining the proper ongoing security practices.
Yeah, and just to expand on that a bit, the other piece here is, HIPAA has been updated a few times in the 20 years, but HITRUST specifically is updated twice a year. It's done with industry guidance, So it adapts much more quickly to emerging threats and what's going on in the environment than HIPAA does as an overall regulation or guidance. So in that way, it in effect is forcing organizations to be more secure rather than kind of giving them an overall guide or directive to be secure.
And again, a little bit of a pivot to just a little bit of lightheartedness here. So again, compliant versus certified, right? Compliant is manufactured or produced in accordance with a specific body, right? As opposed to certified, which is, having been approved by our certificate, is guaranteed and reliably endorsed. And then there's last two are Gary. The rest of us knuckleheads that have worked in this industry for way too long. But again, a certificate is a written testimony. So again, it's a very material difference to have HIPAA compliance versus a HITRUST certification. Because HIPAA compliance also could be just an internal self-assessment, not even one from the outside. So when organizations say we're HIPAA compliant, that's good, but that could largely be their opinion against what the measures are of HIPAA.
And I think I heard you guys say that HIPAA compliance is that, okay, well, there's been an incident, there's been a breach, somebody got my health information. Now somebody's coming in after the fact to say, hey, you weren't HIPAA compliant. Whereas, and I just want to make sure I get this.
Yeah, so up until actually literally this year, because this passed in Congress last year, there were not any proactive reviews by the government of anybody claiming to be HIPAA compliant. So prior to this year, the Office of Civil Rights, the OCR, which is who does HIPAA compliance checks, they were only called in if there was a breach or some incident, and they would come in to be punitive. So they would come in to evaluate an organization to see if they were breached because they were not HIPAA compliant after the fact. Only last year did they begin to, and this is again a change in Congress, to begin to be a little bit more proactive. So they were just begin to randomly audit selected people. And obviously a healthcare provider or a BA or an insurer could always have done their own HIPAA assessment. But again, the crux of being reviewed was almost always after the fact. Where HITRUST is something you have to specifically go and get, contract with a third party, and have it assessed prior to being breached.
Which it would seem like that. I guess it seems like to Bob's prior slide. Yes, I'm certifiably insane, but it would be certifiably insane to want to be judged after the fact.
Correct.
All right, I got it. Go ahead, Bob.
Yep. So we have spoken about some terminology here. So this is HIPAA discussion, right? But there's covered entities and there's business associates, right? And Tim had touched upon this a little while ago, but healthcare providers are covered entities. Health plans or the payors are covered entities along with all the clearinghouses. And then business associates are all the businesses that serve those organizations.
And just as an example of that, and see how this all ties in. There's a famous breach of a payer from several years ago, and that payer really wasn't the one who was breached. It was actually their HVAC vendor who was breached. But that because the HVAC vendor was not secured and existed on the entity's network, hackers got in and got patient health information that way. So that's from the BA up to a health plan.
Yep. And then
that whole HVAC story is getting to be one of those around the campfire stories. Everybody's got an HVAC breach.
It's true. Unfortunately, it's true.
But that goes to the point that we're trying to illustrate here. And there's there's that phrase about something that rolls downhill. It starts with S and there's 4 letters, right? But that's the truth. That rolls downhill, right? So the covered entities need to be concerned about their supply chains, right? So the example that Tim just referenced there, you have a payer, right? A covered entity. They have staffing firms. They have printing firms. They have HVAC firms. These are their business associates. So how does that covered entity ensure that business associates network is secure and properly structured. And if you go back to that slide that we showed earlier about the 5 original payors that banded together, there were 7,500 vendors or business associates they had to worry about. So how do they effectively do it? And how does a business associate who maybe has 2 of them as a customer, how do they do it affordably or efficiently? Because there may be different standards that different people are asked them to be held to. So this is why it was developed. So the covered entities had a simple, easy, and efficient way to help the supply chain downhill with their business associates.
So now just a quick reminder to the audience that we are recording this session, and we will make the recording available to you guys, we say, before close of business today.
Yeah, right. And so as far as everyone being required to be, HITRUST certified, we're going to talk about that in a second here. So, Tim, related to, HITRUST being an industry standard, can you touch upon that, and then we'll talk about, how many organizations have adopted the framework?
Right. So obviously, as it's not a government standard, which is maybe in a way a good thing. There isn't a regulation that says anybody has to be HITRUST certified. It is really an industry-driven thing that's really being pushed by the payers and the providers in the industry. I believe we have some statistics later to talk about just how broadly that's being done today.
Yep. And then just as far as the number of organizations that have adopted it, Tim, it's over 80% of hospitals and health plans have adopted the framework.
Right.
Right. So here's some common misconceptions that we want to talk about. One is, my provider says they're HIPAA compliant, thus so am I. Right. I signed a BAA, so I'm covered. My provider gave me a BAA, so obviously they're compliant. I utilize Evolve IP and their HITRUST certification, which makes me compliant. Right. And only providers need to be compliant. Right. So these are misconceptions, because just because your provider states they're HIPAA compliant, that is their opinion or the opinion of someone they had come in to assess them. That is not necessarily meaning that there won't be fines by the government should there be a breach. And at the end of the day, a provider's assessment doesn't protect the business associate, doesn't protect your customers. And I'll give you another example where there is, a scenario right now that's active that we're competing against somebody else, and we were in the lead because the other provider was not able to provide a business associate agreement to the end user. And then out of nowhere, 2 days later, we were told now we're tied again because that provider all of a sudden had a BAA available, right? So that tells me that they did one of 2 things. They went out and bought additional insurance, or they're rolling the dice. And either way, just because they have a BAA doesn't mean that they have the proper framework in place to protect their customers.
So can you just, real quick, Bob,
I'm not going to say who. Don't ask.
No. But if you could just take an extra 30 seconds and talk about a business associates agreement and what they are, why people are insisting upon them, and what does it get you?
Yeah, let me first talk about what I think might be another misconception there, right, which is a business associate agreement doesn't absolve you of responsibility. And I think some end users believe that they push liability off of themselves onto, in our world, cloud providers by having a business associate agreement. And that's not the way that it's structured. And I'll let Tim expand on that.
A business associate agreement is effectively required by HIPAA for a provider or insurance entity to have with their associates, simply that is stating that the business associate will provide they're conducting business in a HIPAA compliant fashion. But it's not a certification, it's a self-attestment and contractual agreement between the 2 entities. But as Bob said, that could be they're doing it through insurance, or they could simply be just simply stating the fact that they are HIPAA compliant, but not doing it internally up to the standard.
Yep. And typically we want to save questions to the end, but there is a question I think is relevant on this slide, so I am going to ask Tim for you to answer. So the question was, in essence, is a BAA nothing more than an acceptance of risk by the cloud provider?
Yes, but as Bob mentioned, it's not a complete transfer of any liability. So it's requirement that says, yes, we understand that we need to conduct business here in security in a HIPAA compliant fashion, but again, that is open for interpretation as well. So it is simply someone stating that they understand the HIPAA rule set and what's required and will comply with it. But and very, very open to interpretation.
Yeah, and I do feel, from my experience over the years, that a lot of customers, the BAA is a check the box for them.
Absolutely.
They need to either A, sell up, or B, sell to somebody outside. By sell, I mean convince that, oh, we're covered, we have a BAA, as opposed to putting the exact frameworks in place.
Agreed. It is often used in organizations that do not do a lot of due diligence on their partners or BAs. It's used to check the box that says, oh, here our due diligence was to get a BAA. But that doesn't mean anyone's actually reviewed their processes or procedures, or if their security is up to par with what's necessary.
So one of the analogies that I always like to use on my deep dives is that, hey, I've signed a BAA with Evolve IP, and Evolve IP is encrypting my data both at rest and
in transit.
However, if the nurse decides to leave Bob Healy's medical record open for every patient in the waiting room to see, that's a HIPAA breach.
Correct. Yeah. And using Evolve IP does not make you HIPAA compliant, which is, I think, what you're saying.
That's my point there.
Correct. Yeah. We help, and we'll talk about that, but we don't make you, nor does anybody. So what we can look for. So obviously, in addition to all the normal characteristics that we look for in a prospect, right? It's not just the caregivers. It's not just the hospitals or the large practices, but it's all the businesses that serve them. It is the largest industry in the United States of America. Print materials, equipment manufacturing, staffing, technology, and many, many more fall in the category of business associates. Those five larger payors that we referenced earlier, they had a combined 7,500 vendors / providers that they had to be concerned about.
7,500 unique providers.
Yeah, individual.
Many of them shared a lot of the providers. That was 7,500 unique providers.
Yep. Also, focus on, when we say the sweet spot, but the organizations that are most likely looking to need help. Companies that are mid-sized where they've acknowledged they need help with their compliance. Companies already utilizing cloud in their environment, because then we can talk about, is it the right cloud environment for them? And the piece that a lot of people don't think about, and the example I gave earlier about the BAA falls into this category, but you see in contact center opportunities with these businesses, a lot of people think about compute, whether it be IaaS, servers and infrastructure, or desktops, but they fail to realize that UC and contact center is as important when it comes to HITRUST and HIPAA compliance as any other service that might be in the cloud. Okay, so some questions that we can answer. Right? So let's first, what questions don't we want to ask, right? And the reason why we don't want to ask these questions is because the answers could be relatively simplistic and shut you down. What are you doing for HIPAA? Are you compliant? Do you need a BAA? Those questions, it can be easier for a customer, potential customer, to kind of shut us down with, we're covered, we're fine, don't need to worry about that, right? But if we can kind of shift the questions a little bit, to ask about, do you or any of your customers, and this is from, us speaking to our customers, right? Do you or any of your customers have healthcare providers or health plans as customers, right? So, again, my customer may not be a healthcare provider, but my customer may have as a customer a payer or an insurance company. They're the key business associates for us to target in on. And then ask them to talk about their level of discussions they've had regarding HITRUST. And ask them maybe to share the process that it was gone through to certify what providers they're using and if it satisfies applicable compliance. All right? And again, let's remember, over 80% of hospitals and health plans have adopted HITRUST. And 90+ require it today, and it's growing, for their suppliers and vendors. Right? So not everyone requires it. It is not legally the law, but more that it started with 2 years ago, and now it's at 90+ and growing. So the reason is all of these organizations have realized it's better In some ways, you can call it self-policing themselves, but it's better for the industry to come up with the standards, all agree on it, and it makes it more efficient for them and for the organizations that serve them. And it's quickly becoming the go-to compliance because it does incorporate HIPAA, SOC, PCI, and others into one auditable framework. Right? So you're in a better position when you have high trust certification, and then we're able to close firm meetings. We'll dig a little bit deeper on this in a slide or two.
So Bob, I got to go back and I got to ask you a question. One thing I was confused about. So let's say one of our partners is working with a photocopy company.
Mm-hmm.
Right? Who would think? They sell copy machines. Why would they have any interest in HIPAA high trust? You're saying, though, that it's not about our relationship with them, but it's their relationship with the potential hospital and doctor's office that uses their copy machines?
Right. Copy machines go on the network at a hospital or in a doctor's office, so they have to be secured, have to meet HIPAA standards. And so yes, they become a BA for the doctor's office or the health plan and would be under HIPAA rules. And so if that hospital or health plan is requiring them to be high trust certified, it would fall right into there. Yeah.
So would you venture to say, and again, I'm thinking like a sales guy here for a moment, that as any of our partners are talking to their clients, the opening question should be, do you have any healthcare customers?
Questions to ask. Do you or any of your customers have healthcare providers or health plans as customers?
Yeah. Yes. I'm glad you didn't pick me again, you know?
Yes, absolutely. And again, it's the largest industry in the country. 5 of the largest payers had a combined 7,500 unique vendors. The universe is enormous for us.
Yeah.
Right? So, a little bit of a summary. Right? So, high trust certification is a level above HIPAA compliance because it also incorporates others like SOC and PCI into one framework. Most importantly, it is able to be audited and certified. 80% of hospitals and health plans have adopted it, and 90-plus organizations require it for their supply chain. And I'm going to take that a level deeper and give another example. Those who are looking to provide services to these firms are in a much better position with a high trust certification. And this is critically important. And I'm going to give the example and then ask Tim to touch upon this point afterwards. But clients of ours, of Evolve IPs, can inherit the high trust controls of ours that are applicable to them in order to reduce their burden for certification. So let me restate both of those points. I think they're really important. There is a large payer, I'm not going to say them by name, that's East Coast, and they have adopted the high trust framework, but they have not yet required it for their providers and vendors. However, if someone's trying to A, earn their business, or B, retain the business they have with them, they are obviously and logically in a much better position to do so if they have the high trust certification, because that payer is already established, they adhere to high trust. So if they're competing, if Gary and I are competing against each other for a print job with this payer, and one of us is high trust certified and the other one is not, the one who's high trust certified is logically in a much better position because that payer is already established, this is our preferred framework. So again, the high trust controls that we have, and Tim, you can talk about this, but the high trust controls we have are inherited by our customers. So for them to become certified, it's a lot less of a burden.
Right. So obviously, going to any cloud provider, no cloud provider makes you compliant. A customer is compliant through their own actions, their own policies and stuff. However, one of the really great things about high trust and high trust certification is it has a concept of inheritance. So if normally there's between 200 and 400 some controls for high trust, and a good many of them are infrastructure related controls. So if you would do all of your own in-house processing and have all of your own in-house servers, you're going to have say 400 some controls to meet to get high trust certified. However, if you take your environment and move it onto a service provider such as Evolve IP that is already high trust certified, you immediately inherit all of the controls that have already been completed by the provider that would apply to you. So now instead of having 400 some controls, you might be down into 100, 150 controls that are more specific to your business and not the same, you're not having to go through all the nuance of the infrastructure-related things such as passwords and firewalls and segmentation and things like that. So it was designed specifically that way. So just like the BAs are inheriting the providers are inheriting the risk from the BAs, a provider or a BA who's on a certified, HITRUST certified platform can inherit the benefit of it. Again, it doesn't make you completely certified. You still have to go through your own certification process, but it greatly reduces the burden. Our auditor said somewhere between 60 and 70% of the burden to get HITRUST certified from scratch is removed from a entity that is on a HITRUST certified hosting provider or HITRUST provided services.
Good, thank you. Again, BAAs or business associate agreements is a buzzword that is happening more and more. But that agreement protects you. There's shared liability, but it doesn't mean you're secure, and it doesn't mean you're HIPAA compliant or in the appropriate architecture. And again, some providers do cover BAAs simply with liability insurance. Again, it doesn't mean the network's secure. They're rolling the dice with insurance. And no cloud provider, Evolve IP included, makes a customer compliant. However, Evolve IP enables clients to extend their compliance to the cloud. And also, HITRUST is not just for healthcare. We talked about why HITRUST is becoming that preferred framework, because it does incorporate SOC, it does incorporate PCI, it does incorporate other compliances. And separate topic, but we do some work with a research firm that scours the dark web for email vulnerabilities and credentials available for sale on the dark web. And one of the comments that they've made this year is, health records aren't even that valuable anymore because they're almost like a dime a dozen on the dark web. You need to have other personal identifiable information with that health record, like a social security number, like a credit card, like a password, to make that record worth more money, because there's so many available that it's almost a commodity on the dark web. Which is why, again, HITRUST incorporates all those compliances together. So why choose HITRUST, right? So it's not legally required. It requires an outside audit. Tim, why choose HITRUST?
Well, so what is unique to HITRUST really is that it incorporates, as you mentioned, other frameworks and can map to them. So in addition to covering HIPAA controls, by default, you can map ISO to it, you can map NIST. These are other frameworks for security controls that sometimes other industries want, or such as PCI. So now you can have one security framework, one audit per year that covers multiple requirements for different industries. So, for example, everybody in the States is very familiar with a normal SOC 2 report that organizations do. Well, you can have a SOC 2 report now within your HITRUST framework, and so now you can go through one audit a year that gives you basically your SOC report, HITRUST certification, as well as things like PCI. So it really does a great job at adapting to emerging threats and emerging standards, as well as mapping to the other frameworks. So instead of just doing something like just PCI that is very specific only to credit card information, initially HITRUST was very focused on healthcare, but now it has expanded in even for organizations that don't have healthcare data, you can remove some of the healthcare requirements and become HITRUST certified without the HIPAA requirement, if you so chose.
Good, thank you. We're going to wrap up here in a minute or two and get to some questions. One piece I just want to remind everybody about, and Gary probably better speak to this than I am, but just the library of content that we have available. Do you want to touch upon that?
Sure. We have some data sheets available on how to achieve HIPAA compliance, how to achieve PCI compliance, that are available on the support page on our website. Again, I think one of the things about the content that we deliver to the partners is that the content is designed to say, hey, this is what we do, and this is what you need to do. So we cover both. You know, that example of if I'm a nurse and I leave, you know, there's physical security requirements as well as there's information security requirements. So this material is available on the support page on our website.
Yep, and there's also, again, the presentation will be available, but the link at the bottom on our website with compliance and certification has some good information as well. Okay? So Evolve IP, we're here to help, right? Here's some key takeaways. You don't need to be an expert in compliance, right? What we hope the partner community will do is find customers and prospects that want to serve the largest industry in the United States, right? Let's leverage the materials that we have to gain interest, and please engage us for help, right? And then our One Cloud and our certification will be able to shift the discussion to value. Okay?
All right. Thank you, guys. Really appreciate it. Can we unmute the line? And I do have a couple of questions.
The conference has been unmuted.
So, gents, here's a question that came in via the web. It says, I don't have many compute opportunities, but you mentioned PBX and contact center. Can you go back to that and provide a bit more detail around that?
Sure. This is Bob. Let me take that first question, and Tim, maybe ask you to piggyback on my answer, or to append my answer. So I think people falsely think about compliance with HIPAA, HITRUST, with compute-related services, and don't think about the PBX. And as an example, if somebody is providing PBX service, hosted PBX service, over public IP, there is more than a 50-50 chance that that connection is not encrypted, which could very easily be breached. And it is also very common for voicemails and call recordings that have PHI stored there.
PHI?
Being health information.
Patient health information.
Right. So the challenge that you have is that is no different than a server. That information sits on a server somewhere. That has to fall into the same compliance. So people, I think, falsely assume it's a compute product conversation. It is a PBX conversation as well. So call recordings, voicemails, again, insurance companies are probably our sweet spot within this whole vertical because they require the BAA, and you have complex reporting and call recording that you need to have that falls in this infrastructure, and we're able to satisfy that.
Right. Yeah, in Evolved environment, all of the voice side resides on our HITRUST certified infrastructure for compute as well.
Yep.
So, and it's interesting because one of the things that we talk about with PCI compliance all the time is no matter what, you can't record and store credit card information. So if you're running a contact center and employing call recording, you're already non-compliant for PCI if you just record everybody's call. So we got another question here that came in. It says, what is the level of effort to become HITRUST certified, and how long did it take you guys?
Well, that is clearly a question for Tim, because Tim's the one who did the lion's share of the work.
I'll give the typical "it depends" answer. However, in our case, we were lucky since we have kind of a culture of compliance built into the organization, and we already had gone through PCI and others. It wasn't as bad, but it still took almost a year to get through the entire audit. Typically, for organizations that have a robust security program, it could be as little as a year, but it could be upwards of 2 years to get through, kind of going through and getting everything in place that's necessary for it and then being certified. This is where we've really excelled on helping with organizations kind of that, especially ones, for example, that got the letter from the payors where they weren't prepared for it. And so now, instead of them spending their 2-year window trying to tackle all of the requirements by engaging some of Evolve IP services to kind of provide that foundation, they were able to concentrate just on their specific subset and reduce their burden and time frame down to 6 to 9 months.
I have one more. We're going to have to mute everybody. I got one more question here that came in online. Can you be fined against a HITRUST violation the way you can with a HIPAA violation?
Yeah, so again, HITRUST is not a legal compliance or a legal entity. So can you be fined against it? I don't believe so, but I'm going to let Tim answer that, then I want to give an example.
Yeah, so, fines are based on HIPAA violations. So if you were breached, whether you had HITRUST or not, there'd be an investigation by the government to see if you are in compliance or not with HIPAA regulations. If you were outside of HIPAA compliance,
The conference has been muted.
however, Bob, I think you were going to mention this. I'll say that no one's ever seen somebody who is currently HITRUST compliant and were not also HIPAA compliant at the time.
Or PCI.
Yes, or PCI.
Right. Yeah. So I think that's important. Is we had a couple of nationally renowned people in the healthcare industry, and the conversation was, have you ever seen someone at the time of their HITRUST certification also not be HIPAA compliant? The answer was no. Have you ever seen someone at the time of their HITRUST certification not be PCI compliant? And the answer was no. So again, HITRUST becomes an umbrella over all these compliances. 80% of all hospitals and payors have adopted the framework. 90 plus require it for all their providers. And just logically speaking, those who have not required it but have adopted it would look more favorably upon organizations that have been certified when it comes to A, winning, or B, keeping business they have with them.
That's terrific. So go ahead, let's unmute the lines just to check real quick, and then I got a couple.
The conference has been unmuted.
Is there any questions that you guys would like to ask Tim about? Okay, guys, so let's just close here. And I just want to...
The conference has been muted.
Thank you guys, Tim and Bob, for taking the time to participate in this session.
Yeah, thank you. This was good.
And, listen, stuff's complicated. The biggest eye-opener for me was, what I've always thought is, hey, Mr. Sales Partner, do you have a customer that's in the medical business, And it's more than that. It's about, do you have customers that have customers in the healthcare industry? So that was the biggest eye-opener for me. Clearly, we've got a lot of resources. It is a complicated topic, but we absolutely can help. Again, a couple of quick reminders that this session is being recorded. We are going to send a copy of this. The next steps, of course, is how to engage. Any thoughts on that?
Well, I figured you already mentioned about Scott and Rob, so I figured there's probably some additional notification that'll go out as far as who to contact and how.
Yeah, so obviously if you guys have an opportunity, you've got a customer that we need to talk about, always start with your channel advisor. I think in next month's Channel Chatter newsletter, we're going to be sending you guys out a new coverage map so you know who to contact, where your client's at. Start with your channel advisor. Channel advisor will get to Bob and his team, and we'll get you the right resources on the call. Again, a couple of quick reminders. December 8th is the deep dive, and December 14th is the rollout for the Evolved Contact Suite, which, by the way, does allow you to get close to a little bit more on terms of HIPAA and HITRUST. Again, guys, thank you very much. Really appreciate it. And guys on the telephone, thank you for your time. I appreciate it. Everybody have a great day. See ya.